Good morning, everyone, and thank you for joining the Community Care Smart Assistive Technology Collaborative for today's webinar. Allow me to introduce myself. My name is Emma Petherick, and I am the Project Assistant for Global Community Resourcing, and I'm pleased to be the moderator for today's webinar, the focus of which is Australia's use of digital health. Our webinar today is facilitated by Global Community Resourcing for the Community Care Smart Assistive Technology Collaborative. If you've joined us from previous webinars, you'll know that they are designed from feedback and requests we've received through the collaborative. The focus of our webinars is to bring together local, national and international perspectives in research and development, as well as the deployment of smart assistive technology in the community care sector. Global Community Resourcing has extensive international linkages, and we have been fortunate enough to work on many international projects and research entities. Just a reminder that if you haven't formally registered at the collaborative site, it is accessible to all and free to register. Please note that neither Global Community Resourcing or the Department of Communities, Disability Services and Seniors are promoting or endorsing any particular product, research entity or organisation. The purpose of our webinars is to serve and to inform viewers of various smart assistive technologies currently in development and/or deployment. We welcome questions, but I will let you know that all microphones have been muted. This is in the interest of recording. Your questions can be added to the questions panel on the dashboard on the right of your screen. There will be an opportunity for your questions to be answered at the end of the session. At previous sessions, we've been inundated with questions, so the earlier you post your questions, the more questions we can respond to. In this webinar, Professor Deborah Lupton will introduce Australians' use of digital health and what works in this space. Professor Lupton is Centenary Research Professor in the News and Media Research Centre, Faculty of Arts and Design, University of Canberra. She is a Fellow of the Academy of the Social Sciences in Australia and co-leader in the Digital Data and Social Society Consortium. Her latest books are Digital Society and Quantified Self and Digital Health. Her current research interests involve all aspects of digital sociology, digital health, digital data cultures, self-tracking practices, digital food cultures, digitized academia, and the digital surveillance of children and young people. Welcome, Professor Lupton. Take it away.
Hi there, thanks very much, Emma, and good morning, everyone. So I'm a sociologist, and I'd like to talk today about several research projects that I've been working on over the past few years, and they all are to do with how Australians use digital health, and there's a number of different projects that involve different groups of Australians. And I think it's quite interesting to look at some of the similarities and differences across the different groups that I've done research with. To talk about the social aspects, because I'm a sociologist, I'm interested in what are the social aspects of the way that people use digital technologies, including for health. And that involves things like how aspects like gender and people's social class and their age, also where they live, their location, their health status, so whether they are healthy and fit or whether they have a disability or living with a chronic illness, their ethnicity and their education levels, because all of those aspects I'm finding in my research are really having a major impact on the way that people engage with digital health technologies. I'm also interested in what the unintended consequences are of digital health. So when you look at the way that digital health technologies are promoted to the community, whether it's by the tech developers themselves who basically want to sell their products to users or to organisations, or whether you look at the way that governments try to promote digital health, or even in schools more and more in health and phys ed classes, for example, teachers are using digital health technologies. I'm interested in what the big difference might be between how the promotion of digital health might be different from the lived experience of digital health. So there's a lot of promises made about how digital health technologies can change people's lives and how it can make them healthier and or fitter or contribute to their well-being. But when you actually look in more detail as to how people are engaging with these technologies, then you get a more complex picture. And one big difference is that often the tech developers who invent and design and put onto the market these technologies, they are often from a very certain social group of people. They are often white men living in Silicon Valley, middle class, highly educated, privileged people, and they can have a bit of a blindness to how people from other social groups might want to engage with the technologies that they're designing, because they sort of tend to develop and design technologies for their own demographic. What this can mean is that there's unintended consequences, that some social groups tend to be left out, their needs aren't catered for. So I think that's a continuing issue that people who are interested in how digital health technologies can be successfully used need to confront. And I think it's important that the developers and the promoters of these digital health technologies are engaging with social researchers who are able to actually look at the lived experiences of people's use of digital health. So that's why I'm really keen as a sociologist to look at these aspects. So what I want to do before talking about my actual research projects is just so that we all are aware of the digital health ecosystem. That is, all the different ways in which commercial enterprises, but also government enterprises, are coming together to offer certain kinds of digital health technologies to Australians. So to begin with, we have electronic health records and My Health Record, which is an initiative that the Australian Digital Health Agency is currently trying to roll out successfully and to get enough people signed up. They've had a few problems in getting people to sign up to My Health Record. And very soon, in fact from next month, there's going to be an opt-out process. So no longer is it going to be an opt-in process. And there's an interesting issue here around whether there's informed consent about the opt-in process and how much the Australian Digital Health Agency is going to let people know about that process. So that's actually quite an interesting issue in itself. But there are many benefits that can be offered if My Health Record is rolled out successfully and enough patients and enough healthcare professionals are engaging with it. It can obviously provide a great resource for both patients and healthcare providers. Now, telemedicine, for many years now, actually, for probably about 20 years since we have had wide access to digital technologies such as computing and then later Wi-Fi, telemedicine has been a way of reaching remote communities and people who otherwise don't have very good access to healthcare providers. I think it's actually more advanced in the US at the moment than in Australia because, again, telehealth, telemedicine has had a few difficulties in getting rolled out successfully. But this slide is a photo of a booth that's offered in the United States, and often they're offered in workplaces so that people can go in during a break and engage with an online doctor. And as you can see, there's a doctor there on the screen. And if you look around the booth, it's quite interesting. There's all sorts of digital health technologies that the patient themselves uses. So that woman there's got a stethoscope that's going to be sending the recordings back to the doctor, and there's various other implements that she can use that the doctor will then engage with the data that she produces and come to a diagnosis. So I think that the Australian government is probably going to be wanting to roll out more effective telemedicine, but as I say, we're sort of a bit behind what's going on in the US at the moment. Now we also have to look at, we look at the digital health ecosystem, we have to look at the social media platforms that actually are a very important place for people to get information about health and medicine. Now this is an example from the Black Dog Institute, which of course is about supporting people's mental health here in Australia. And so you get that kind of Facebook page where organisations in Australia have their own Facebook page, but of course there are many, many other patient-led communities, often around patient-specific conditions, where people have just got together and organised a group themselves, and they are a very important way for people to share information about the sorts of experiences they have of a health issue and what treatments or what healthcare providers have worked best for them. Now, Pinterest is another social media platform that we might not often think about in terms of health and medicine, but if you are a member of Pinterest, you will know that that social media platform is used for curating information and often very visual information about particular issues that people are interested in. They create boards. This is an example of a board that I just went into Pinterest and searched for health and fitness, and as you can see, there's lots of visual material there, and then you can click through on the links and go to the actual websites that they come from, and they, as you can see, there's a great sort of diversity of information that's given there, some of it which is probably quite spurious and dubious, but there could well be also other issues that are covered on Pinterest that do provide important information to people, for example, about promoting their health and well-being. Twitter is also used a lot for people to engage with each other and also to engage with healthcare providers, and also for healthcare providers to have their own peer communities on. Now, the Healthcare Hashtag Project, which is run by the company Simpler, is a really interesting website. Anyone can go onto it, and you can actually see the hashtags that they've collected there. Hashtags are the way that people organise communities on Twitter, so they might have a hashtag that's around diabetes, a hashtag around heart disease and those sorts of things, and that's the way that people find each other on Twitter. And that's an example of hashtag diabetes, if you see at the top there. And there's also some really interesting information that's brought together on this platform, the Healthcare Hashtags platform. You can see who's talking, and you can see on the right-hand side who's talking and using the hashtag diabetes. There's a tweet activity graph there that you can look at. You can compare it to other related hashtags. So it's really a really interesting source of information for people who want to know about how patients and healthcare providers are talking about particular conditions or health-related issues on Twitter. Now, YouTube, we might not often think about YouTube as an information source for medical and health issues, but a lot of people do use YouTube, and what they find most valuable about YouTube is that they can see, they can actually view a video that they can repeat, they can stop it at any point, and they can actually get a really detailed visual, gets back again to the visual aspects of how to do certain things or what people's experiences of certain health and medical conditions. For example, there's a whole genre on YouTube which is people who've uploaded their birth videos. So if women or their partners are interested in what the actual birthing process is, they can go straight onto YouTube, and there's many videos there that people have posted of what happened in their own birth. And they're often very detailed and quite graphic. But it's a good way for people to get an understanding of what goes on at the moment of birth. And this is an example I'm showing here of do-it-yourself surgery, which is a genre on YouTube, quite an unusual genre, and that's where people have posted videos of how they have dealt with procedures themselves. For example, if you look down, you can see one of them is a bullet extraction from a leg that a person has basically either performed on themselves or they've done it for someone else at home. There's a do-it-yourself surgery on an infected cyst. Lots of really quite unusual procedures there, and the whole idea is that the average person, rather than going to see a doctor, can view these YouTube videos and work out how to do these surgical procedures themselves. Patient support platforms. This is Patients Like Me, which is a very popular patient support platform, is another example of a dedicated platform just for patients to share with each other their experiences and to build communities around their specific conditions. Now, apps are another way that people learn about and also monitor their health and well-being and fitness levels. There are now over 325,000 health and medical apps available on the two major app stores, Google Play and the Apple App Store. This is an example, a screenshot I took from the Google Play Store when I put in health and medical apps, but they're only a small example of these tens of thousands, or hundreds of thousands actually, health and medical apps that are available. Now, because there are so many apps and because new apps get put on these app stores every day, thousands of them. There's a really interesting issue there for the consumer, because it is often difficult when you go into the app stores and you're looking at the apps and deciding whether they're going to be any use to you, to decide which is a high quality app. And there's just so many of them, it's sometimes really difficult to find the best apps. One way that people can do it is to look at other people's reviews of apps, but that's not always the best way to find out whether an app is medically accurate, for example. And it's interesting, the National Health Service in the UK is trying to do a process whereby they evaluate health and medical apps, and they have a certain section of their website where they suggest apps that they have reviewed and consider to be accurate and valid, and therefore can recommend to the British patients who might be looking on the National Health Service website. We don't have a similar thing here in Australia, but it is a major issue, because if people do want to use health and medical apps, as I say, the quality can be so variable. Some of them can be extremely well validated in terms of having many medical and other healthcare professionals involved in their development, but others of the apps, if you look closely at them, are actually made by game developers, and they're really very poor in their quality. So that really is a really important issue about how patients can find the best apps and which apps should be recommended by healthcare providers to healthcare consumers. Then you have the wireless mobile health devices that link into smartphones. So this is an example of a blood pressure monitor that can be used at home, linked to the smartphone app on the smartphone. You can also get sensor-embedded clothing these days, or footwear, that monitors many body metrics such as blood pressure, body temperature, heart rate, and so on. So there are many opportunities now for people to buy their own products or to have them provided by a healthcare provider that does this kind of close monitoring of their body metrics. And of course, there's all sorts of these self-tracking devices as well, devices such as smartwatches and devices such as bracelets, and even devices you can put around your head to monitor your sleep levels. Fitbit's the most popular out of these at the moment. That's an example of the Apple Watch, which is probably the most, it's starting to overtake devices like Fitbit. It's becoming very popular for people who want to measure body metrics, and as you can see there, things like exercise levels, how long people have been sitting for, are the sorts of things that the Apple Watch will measure, heart rate, those sorts of things. It can set it up so it will give you regular nudges to tell you, it will sort of buzz and you'll feel it on your wrist to tell you that you've been sitting for too long, for example. And just finally, the smart home, which I know is an issue that a lot of people interested in assistive technologies are looking to develop and promote. And as you can see there are many kinds of digital technologies that can be involved in the smart home. So from the digital camera surveillance of people's movements around the home, health and wellness related to things like wearable devices and patient self-care devices that they might be using to monitor chronic health conditions. Even energy management can be part of the smart home, elderly care, so the various sensors that can be put into the smart home to monitor the movements of and the health levels of older people. Now, one thing I think is really important, again as a sociologist, I'm interested in the social issues of the very sensitive and very personal data that are generated by people's engagements online and with apps and wearable devices. Now, there's a lot of key issues there. We've had lots of scandals in Australia recently about the way that the government is using people's data, for example, the robo-debt scandal around Centenary and the Australian Tax Office, and how they were asking people, telling people that they had they needed to repay overpayments, which has caused a little bit of disquiet amongst people who might be thinking about signing up for my health record, because that is all through the MyGov website as well. We've had an incident reported of people's Medicare details being available for sale on the dark web, and it's believed that someone who worked in Medicare or related to the software involved with Medicare was responsible for doing that. We've also had, of course, a lot of scandals about social media platforms like Facebook and how Facebook sell people's data to third parties to profit from them. So when you look at this, this image here, it's showing that sort of ecosystem of the way that people's personal health data they go up to the cloud computing repositories, and there they can be accessed legally by the companies that are involved with offering those online services or apps. But what's really important too is that there's two central ways in which people's data can be illegally accessed. So when they're being sent to the cloud computing archive, or when they already are in the cloud computing archive, basically the problem is that once people have generated these data, whether it's from an app or a wearable device or moving around in a smart home with sensors, or going online to search for health information, once those data are generated and they go into the cloud computing environment, they've lost control over their personal data, and they can be hacked, they can be breached, they can be stolen, as well as being legally sold to third parties. So I think that's a really important issue to consider. There's actually an ethical issue there, because if healthcare providers or service workers are encouraging people to sign up to digital health technologies that collect very detailed and personal and often very sensitive information about themselves, they need to be aware of the risks and harms of those data potentially being hacked or stolen or being exploited by third parties. So what I'd like to do, now that we've sort of established the sort of environment in which lots of digital health technologies are being promoted and used, I'd like to talk now about the projects that I've engaged in, talking to people about how they're using these technologies. So there's been 5 major projects that I've been involved with over the past few years. The first project looked at self-tracking cyclists, and they were people who lived in either Melbourne or Canberra, because I was working with Melbourne's colleagues as well, and I'm based in Canberra. And what we did there is we recruited cyclists who commuted to work on their bikes, and we were interested in people who use digital technologies to monitor their rides. And we were interested in how they engaged with the data they collected, and also why it is that they did track their rides, the kinds of technologies they used, and those sorts of things. So what we did is we actually bought some GoPro cameras. Now these are tiny, what's called action cameras, and they are used a lot in sporting contexts by people who want to make a video of what they're doing in relation to their sport. So they might be mountain climbing, they might be even surfing, as well as riding a bike or running, and all those sorts of activities. So we invited our participants to wear a tiny GoPro camera on their helmet, and to get ready for one of their bike rides to work, and to wear the GoPro on their helmet while they did their trip to work. And what we did then is, once we had collected that video from their ride, we sat down with our participants and we looked at the video of the ride together with the participants, and we talked to them about the environment that they were riding through, what they were looking at, whether they were checking their digital device, how that checking of their digital device might have changed the way they rode, might have made them go faster, for example. There's sorts of other distractions that they were experiencing, whether it was traffic or animals such as birds or dogs that might have been on the path, and other cyclists and that sort of thing. So that was really quite an interesting way of looking at the motivations for people, why they use digital tracking devices, and that included devices that they put on their bikes as well. So several people had bike computers, or they had smartwatches, or had apps. And we were really interested to find out when they reviewed their data and how that affected their cycling practices. And what was interesting about that project was that we had both men and women in the project. What these cyclists found really motivating about using digital tracking technologies was, for many of them, the competition. So they were engaging on platforms like Strava, which is a platform where you can join up with other athletes and you can compare your data that you've collected. You upload your data from your digital device to the Strava platform, and other people can comment on your rides, and they can give you what's called kudos, which is basically saying, you know, good job, well done. And you can compete on segments of the rides as well to see who got the best time on those segments. So we found with these self-tracking cyclists that the element of competition was really a motivating force for them, that they really enjoyed as part of their digitised self-tracking practices. We also found, particularly for some of the women involved, that it helped them with their confidence. So they'd taken up cycling again after quite a long period of time, maybe when they hadn't ridden a bike for quite a while. And they found that tracking, you know, how fast they were getting over their trip, for example, was a really good way of them feeling more confident about their riding. So they weren't necessarily very competitive. They didn't necessarily share their data, but for them it was just seeing their own data and basically telling from their data that they were getting fitter and they were getting faster over their the trip they took to work. Some people engage with their data in real time, and so they were looking, for example, at their bike computer as they were riding, and that sort of changed the way they were riding. And we were also interested in their everyday routine, so how it was that becoming a practiced use of digital health, digital self-tracking technologies in this context became basically part of their everyday routines. And because we had a video of them getting ready for a ride, we were able to see when they turned on their devices, when they turned them off, when they sat down and looked at their data and so on. So that was quite an interesting project because we had those videos of the rides, and we were able to talk to people about it, which gave us a lot of insights into their practices. Now, the second project. This was a project on another very specific demographic. This was women who were either pregnant at the time or had a small child under the age of 3, so had given birth within the past 3 years. And I was really interested to find out how women were using apps and other digital devices as part of pregnancy or as part of early parenting. One reason for that is I've been interested in the transition to parenthood for a long time, and I've done research talking to both men and women about their experiences of pregnancy and of becoming a parent for the first time. Now, of course, we have all these digital devices that people can use to support pregnancy and early parenting. So I was wondering how Australian women were using these technologies. So actually, I don't mention it here, but there was actually a third part. So there were interviews and focus groups, but there also was a survey of 410 women around Australia, and I got access to these women through a market research company who recruited the women. So they lived in every state of Australia. And the interviews and focus groups were in Sydney. So what I found from this project was that the use of pregnancy apps was very high. So in the survey, 3/4 of the women said that they had used at least one pregnancy app. And half of them said they had used at least one parenting app. What they found really useful about those apps in pregnancy, for example, was again getting back to tracking the progress of their pregnancy, tracking the progress of the development of the fetus, being able to customize apps so that they could actually put in their expected date of birth, of delivery, and they could even put in the name of their expected child. So that they were getting customized updates from the app each week about where the pregnancy was in terms of gestation and what types of things were happening with the fetus. And that gave people quite a lot of confidence, because a lot of women are quite anxious in pregnancy, and they obviously want to know that they're doing all the right things and that they're monitoring the progress of the pregnancy. So apps, I mean, women used to do that with handbooks. There used to be a whole lot of books that women use to check week by week the development of their pregnancy and fetus. But now many of them use apps instead to do that. In terms of parenting apps, there were, again, tracking the development and progress of and well-being of their baby was something that the women found really useful and important. So there's lots of these kinds of apps available on the two major app stores for parenting, for early parenting. And they are again, there used to be handbooks for people to use to track the development of their children, to check against their milestones and so on. But now that they can get apps which are very customized to the age of the child, and that actually send notifications often to help people to know what to expect from the development of their baby. Now, in the focus groups, that was an opportunity again, and interviews, to talk to women more directly and in more detail about what it is that they found useful and which apps and which social media sites they found most useful. Now, it's interesting when talking to women is that they still really like websites and discussion forums, and these have been digital media that have been around now for quite a long time, again since the introduction of the internet and the World Wide Web. But they still are very popular with women. So even though in the last 10 years we have had the emergence, or 10 to 15 years, of social media sites like Facebook, like Instagram, Pinterest, Twitter, women these days still really like going on to the old style websites and online discussion forums. Having said that, many of them were using Facebook, and particularly to engage with women living in their local area. So there were often mothers groups for a particular area that were established on Facebook. And the beauty of that, women said, was that they could get information about local services in their area, what was a good park to take their children to, what was a good GP, those sorts of things. But they could also arrange meetups face-to-face. And what came out strongly in the focus groups was that women are highly anxious during pregnancy and early parenting, particularly if it's their first child. They really want to get peer support from other women going through the same experiences. They really like the fact that they can use their smartphone to go online any time of day or night. And of course, with tiny infants, they are often up in the middle of the night, breastfeeding or otherwise bottle feeding their babies. So if they're worried about their baby, if their baby seems not to be feeding or sleeping well, or even if they just want to connect and have a friendly chat to other women, there will always be someone else, either in Australia or internationally, online that they can engage with. So it was a real sort of lifeline for women in those situations, and they really did benefit and talked about the support and the sharing of information that they got from other women online. Facebook groups meant that they could meet face-to-face, and one of the issues that women were facing were loneliness, isolation, the fact that they'd left work and they were now at home with a baby. They were in many cases feeling quite not only anxious but also quite isolated from other people. So Facebook allowed them both to have that local connection and also to be able to arrange face-to-face meetups, which was really important to them for their mental health and well-being. one thing that the women talked about a lot was the fact that they were constantly Googling for information. So they said, I'm constantly on Google, constantly looking for, you know, again, if they were a first-time parent in particular, information about infant behaviour, infant health and well-being, development. They were looking for reassurance. They were again going to medically oriented websites, but they also found other women's experience really valuable. Now, when I asked them what kind of ideal digital health technology could be invented for you that doesn't exist, though, it was interesting that they said, well, it's really great to be connected to other women 24/7 through online platforms, but what they really would like to also have that access to healthcare providers 24/7 online, so they could actually, and they sort of said things like it'd be great to be able to talk by Skype, for instance, like a Skype-based platform where they could talk to a healthcare provider and about the health and well-being of their infant if they were worried about something. So that's something to bear in mind, I think, if we're looking for the kinds of services that women with small children might be looking for. Now, the third project, people who self-track for any purpose. So this was looking at self-identified self-trackers. It involved telephone interviews with people around Australia, men and women. And I was interested in people who had taken up self-tracking for any reason, using any kind of method. I was interested in what method they were using and what they were self-tracking. What was really interesting about this project was that even though digital self-tracking devices were used by a lot of these people, non-digital devices were also really important for them. So the time-honoured method of the pen and paper diary or just notebook, writing down aspects about their health and well-being in a diary or notebook was something that a lot of these people were doing. And they also talked about just being aware of their health state or their emotional state just by basically remembering details. So they didn't use any kind of technology, they just used their brain really just to keep awareness of and remembering from day to day aspects about their health states or their otherwise well-being, such as their moods and their emotions. They did talk about older style of online technologies like spreadsheets and using those as a way of tracking their health-related indicators. But apps were quite popular amongst this group, and to a lesser extent wearable devices like Fitbits and smartwatches. And what you were also seeing there is people who use a whole range of different approaches. So they might have an app to monitor some aspect of their health, they might be using a pen and paper diary to monitor something else, or they might just be remembering something in their head as well. So they were doing all those things together at the same time. Now, in terms of the most popular aspects of their health that they were tracking, food and nutrition came out as number one. That was the most common thing that people were tracking. And that was followed by heart rate or exercise and fitness indicators, and then by body weight. So those were the things that people were using digital or non-digital devices to track about their lives. Some people were also tracking things like blood pressure and sleep, medication, and their moods. If they had an anxiety or depression-related disorder, for example, they were attempting to get on top of that by tracking what was going on and whether their therapies were helping them. And it was interesting that there were quite a few people in this study who had a chronic health condition, such as diabetes or high blood pressure, and they were tracking quite a few different things about themselves. And they did talk about how they enjoy, well, no, enjoyment probably isn't the right word. They appreciated the benefits that self-tracking gave them, because it did mean that they felt like they were exerting better control over their lives and their health states. And they obviously, to get a diagnosis of a condition like diabetes or high blood pressure can be very challenging for some people. and they actually appreciated being able to get on top of their health and to improve their health by using self-tracking practices. But for some people, it did become quite a burden as well. So while they appreciated the benefits, they did talk about how it was a lot of work and they didn't necessarily always want to think about their health, but they sort of had to because they had to do this regular tracking. So that was an interesting finding of sort of the burden of self-tracking came out from some of the people who had chronic health conditions. Now, number 4, women's use of digital health. Now, I mentioned earlier on that digital health technologies are often designed by middle-class white men in Silicon Valley. What this means is that the needs and uses of women of these technologies can sometimes not be incorporated. So there was a lot of controversy, for example, when the Apple Watch, the first iteration of the Apple Watch, was released in 2015, because it didn't have any apps on it that were designed for menstrual tracking or fertility tracking, but these apps are very highly used by women of the age group, of the sort of fertile age group, or that age pre-menopause. So there was a lot of controversy there that Apple hadn't really thought of that use of their smartwatch. And basically that's because it was designed by men who didn't really consider that that might be one important use of the smartwatch. So I was interested in exploring specifically Australian women's use of digital health technology across the whole spectrum that are available to them, because one of my interests too was, well, okay, there's been these technologies that have been around for a long time, search engines, websites, discussion forums, they've been around for a long time now, 20 or more years. Are women still using those a lot? Are they using other media as well, or more than the older media, digital media? So this project involved interviews with women around Australia, telephone interviews again, because that's an easy way to access women, but also focus groups in Canberra. And it was across, I was also interested in women across the whole age group. So it involved women, I think the youngest woman involved was 21 and the oldest was 75 in this project. Now, what I found was that every woman in this project used Google search all the time. There was very high use of going online and just searching for health-related information. Now, when you think back to before the advent of the internet, there weren't many forms of media that people could use to find information about health and medical issues. They could get a book out of a library or buy a book. They might be a member of a patient support group that met face-to-face, or might have had a little newsletter that was sent in the mail. But apart from that, there were very few opportunities for people to search for information themselves. They had to rely on healthcare providers. But of course, these days, everyone Googles health and medical information, and these women talked about how that was just a regular practice for them. What was also interesting was that they also Googled for information for people that they lived with. So whether it was their children or their partners or their elderly parents, they sometimes took on that role as sort of carers, I suppose, in terms of finding out information that might be relevant to those family members. And this was the case even for women with adult children. They often did go online to search for information related to their adult children's health. What was interesting, though, is that doctors are still important, and so are friends and family, so that these women still really valued face-to-face interactions with their doctors. So they sort of went through a system where they went online, they did a bit of research into symptoms or a health concern. They then decided whether they needed to see a doctor. So it was a sort of preliminary process whereby they thought, okay, it's not that important, not that serious, I'll be okay, I don't need to see a doctor, or no, I do need to see a doctor. So it's not as if the doctor's authority was actually flouted or challenged by this. It was actually an adjunct to seeking medical help. And I think there's been a lot of concern amongst the medical profession about what, Dr. Google and cyberchondria and all those sorts of issues. But in fact, what I found from this research is that women haven't lost their respect for the medical profession. And as I say, they tend to use Googling for health and medical information as an adjunct, or as a sort of screening process for themselves to decide whether they do want to actually or need to go and see a doctor. And it's interesting that friends and family are also important, and face-to-face encounters with friends and family, not online. So people often ask their friends and family for advice about what they should do about a health issue or whether they should see a doctor. And what also came out as interesting in this project was that even though most women didn't use books anymore for finding out health and medical information, they did use pamphlets. And that's because when they do go and see a doctor, there's always pamphlets in the surgery, and they nearly always have to wait for quite a while to see the doctor, so they pick up a pamphlet. So that's an old media form that is still actually quite important for women in terms of getting health and medical information. Having said that, they hardly mention traditional news media at all, so they didn't talk about newspapers much at all in terms of health and medical information. As I said, they didn't tend to read books very often either anymore. Now, what also came out from that study was that local information was also important to women. So they've said that it's good to go online and go to international websites that, like WebMD, which they considered to be very good in terms of the quality of information, but they still did want to find locally based information, so they often looked for Australian websites, and they often did look for government related websites or organisations like the Heart Foundation or Diabetes Australia or something like that, which they understood would be authoritative sources and that they could trust in the information that they found on those sources. Now finally, young people's use of digital health. So that's a project that I'm actually going through at the moment. I'm going through the interviews with young people. So I haven't finished looking through them, but what's coming out from this study is, again, young people Google health and medical information all the time. But again, they still have a lot of trust in doctors, and they still do like to talk to friends and family, and often their own parents, to get advice about their health issues. So it's not like online has become even for young people, and we're talking about this involved young people aged between 16 and 25. So it's not as if they are going completely online for health and medical information. They are quite a lot, but they still really do value doctors and friends and family as sources of information. And interestingly, apps, even though some use apps, we might expect that more would use apps than came out in this study. And a few wearable devices was quite popular, but again, not as popular as using Google search or going to health websites. So the old health website was still very highly used amongst young people, more highly used than apps and wearable devices for health and medical information. And the kind of apps they used were things like mindfulness apps or appointment booking apps or sleep tracking or step tracking apps or period tracking apps, as I talked about. Menstrual tracking apps was popular amongst the young women in this group. So just to finish up, so to allow some time for questions, just to as an overview of all these different projects, I think the key, that I haven't already I've talked about the findings, but some of the key findings that have come out across these groups, different groups of people, just to summarise, so websites and search engines remain very important and highly used sources of online health information, particularly websites that are considered to be authoritative, such as government and other well-known organisations' websites. Doctors and other healthcare professionals, as well as family and friends, are still key trusted sources of health and medical information. It's interesting with my health record, which I mentioned first up in this webinar, that I talked to the women in the Women's Project and I talked to the young people. There was actually a fairly low awareness about my health record. people really hadn't heard of it. They hadn't signed up to it. So it looks like the My Health Record, Digital Health Agency people need to really do a lot more in terms of publicising My Health Record if they want people to sign up to it. I also found that of those people who had heard about it, there were quite a few who were a bit dubious about the data privacy issues there too. So that's an issue that the Australian Digital Health Agency will need to confront. I also found that the broader ecosystem of technologies, including non-digital as well as digital, needs to be acknowledged, and that gets back to the fact that people, the self-tracking people, did use pen and paper and just memorising things, and that friends and family and doctors were still considered important sources of information. And getting back to data privacy and security, apart from the My Health Record, I also had, in each of these projects, I always include questions about, do you ever wonder where your medical data go or health data go, and are you concerned about it? I'm still finding, despite the various scandals that have received a high level of publicity in Australia around people's health and other personal data, most people, for the most part, aren't really concerned about it. They don't even really think about it. And I think that is, again, an important issue when we can see how easily health and medical data can be accessed for legal or illegal purposes. I'm finding that the Australian public aren't really concerned about it and don't really think about it, but I think it is something they need to think a bit more about. I did find that factors such as people's age, gender, their caring responsibilities, their working conditions, their state of health, demands on their time, and their relationships and interactions with other people, both in person and online, were important contributors to their experiences of digital health. And one aspect of that was biographical features of people's lives. So turning points such as hitting a landmark birthday can often change people's use of digital health, so that turning 50 might be a point at which people decide they need to spend more time monitoring their health. The birth of children came out in not only women but men's accounts of why they took up digital health technologies, such as using a Fitbit so that they could be more healthy. Having said that, women with a young baby often couldn't use the Fitbit as much as they did before because they simply didn't have the time or energy. And also, developing a chronic illness was a key motivation force for people using digital health and continuing to use digital health related technologies. So I see there's only about 6 minutes left before the webinar finishes, so I think I'll stop now, and I'll be interested to hear if anyone has any questions. Thanks very much.
Thank you, Deborah. That was a very interesting presentation. We do only have time for a couple of questions, but that's okay. The first one we've got here is, how can clients who want to become digitally included navigate the App Store to find apps that will help them improve their quality of life? Has your research found any apps that are better than others? Are there any particular keywords that they can use to actually get better quality apps?
Okay, my research found that there are some apps that people do find really useful, like Map My Ride for fitness tracking, and there's a few calorie counting apps that people do tend to find useful. It is a very difficult issue. I would suggest that the best way to do it would be just to go online and do your own research. And you know, there are various sites that rank and rate apps. So, or you could go to the National Health Service site that I talked about earlier too, to see what they suggest, because they have gone through that evaluation process, and they're going to release more and more information on that. They're really stepping up that evaluation process. But if you're interested in, say, calorie counting apps, you could Google best calorie counting apps, and that would be one way to do it. But probably the National Health Service page on their recommendations for apps is really the best way to do it, because they have been properly evaluated by healthcare professionals.
Excellent, thank you for that. Ben has asked, he works for a local service provider. Are there any applications that you could recommend that would benefit older people living at home who want to keep an eye on their health, and any applications that can use that data that can be shared with their family members, so that if your family member, for example, is living out of town, not able to see their loved one very often, that they can actually see how their self-monitored health is tracking?
I don't know of any commercial apps where you can easily do that. The only one I know about is a pregnancy app where you can share it with your partner, your data. I don't know of any for older people actually, so that might be a gap in the market, I think. So no, I can't really recommend any. I haven't actually done a lot of research with older people living at home needing assisted care. The only project that I've started to do is with the Heart Foundation, where I've done just a initial discussion group with a cardiac rehabilitation group at Canberra Hospital here in Canberra. And that was talking to people who were visiting the hospital post cardiac surgery. And of course, many of those people were in the older age group. There are quite a few people in their 70s and early 80s. What was interesting there was that when I walked in and started talking to these people about the use of digital health, I asked who here has a smartphone, and only half of the people put their hands up. So I think we need to take a step back in that, recognising that once you get to sort of, my other project stopped at sort of the age of 75. And I'm finding that people up to that age, and particularly in their 50s and 60s, are quite avid users of, say, Fitbit or calorie counting apps, particularly women. I think once you get past the age of 75, you are now reaching an age group where people are far less confident about using smart applications, smartphones and so on, and in fact don't even own them. So it's not even just an issue of finding the right app. The question is whether they in fact have a device and they're familiar with that device to use an app on.
That's an excellent point. Well, we'll wrap it up there. I think we're almost out of time. So thank you for all of those questions, and also for Professor Deborah Lupton for answering them. If you haven't already done so, please go online and register for the Community Care Smart Assistive Technology Collaborative. You'll be able to access today's presentation and have the opportunity to ask further questions. Please check the collaborative for more information on those upcoming events. And if you have any further questions or inquiries, please email us at sat@communityresourcing.com.au. Once again, I'd like to thank the members of the collaborative research team, the Queensland Government, and today's guest speaker, Professor Deborah Lupton. Thank you everyone for attending today's session.